Hi, and welcome to the show. Rate and review at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today, we welcome back on the show Manny Konstantakos and Jeff Morris. Manny's an orthopedic surgeon. Jeff is the CEO of the American Board of Physician Specialties. I had them back on the show in the summer of 21. It's been a long time since we last chatted, so both of you, welcome to the show.
Thank you very much, Kevin.
Thank you.
And it's unlikely that a lot of listeners have listened back to our first episode about a year and a half ago. So just briefly introduce yourself and share your journey to where you are today. So Manny, why don't you go first?
Sure. Well, thank you very much, Kevin. Yeah, so my name is Manny Konstantakos. I am a board certified orthopedic surgeon. I went to both college and medical school at Case Western Reserve University. I did my orthopedics residency at Wright State, and I did a fellowship in sports medicine at the University of Chicago. I really enjoy practicing orthopedics. It's a great field and very glad to be doing that.
Perfect. And Manny, just take us through a typical day, typical cases that you would see on a routine basis.
So my practice mainly is focused on sports medicine. I do take general orthopedics call, and a lot of it happens to be with not just athletes, even though my fellowship is centered on athletes. A lot of this sometimes weekend warriors or just people that are reaching behind the seat in a car and then bam, they get some subacromial bursitis. So day-to-day things that I think society thinks, well, you're dealing with the NFL, college athletes. Very, very rarely do I even see that. But mainly it's the regular people that are putting in hard hours at work, whether it's a sit-down job or people that do manual labor. And my focus on all patient care is always to do what I can non-operatively first. I truly believe that the body has the ability to heal itself, just like the Greek philosopher Socrates said, a healthy mind and a healthy body. And they can't really separate the mind, body, and spirit. So once that's fully appreciated, then if surgery is done, that surgery is the last resort, except in cases of trauma surgery, like a car accident or something like that. But so that's really my approach, is that the body can really heal itself. And that's my main focus.
Sure. So I'm an internal medicine primary care doctor. So tell us one tip to my audience that would prevent me from sending patients to doctors like yourself.
Well, some tips. Well, first of all, it starts with a healthy attitude and healthy nutrition. So I think getting up in the morning, I think just drink a glass of water really helps get the body going. Putting in a good amount of sleep at night, having good mattress, for example. Sometimes we sleep wrong, and just putting that pressure instead of putting our pillows on one or two pillows, especially have bigger shoulders. You don't want to be at that sort of good angle, so you're not doing this and causing pressure on your shoulder. Also, just trying to keep your hands in front of your body. Sometimes when our hands, or elbows especially, go out this way, we do cause impingement. And that's more prevalent once we get to the age of 30. We start seeing that more of impingement, and that's also very prevalent.
All right. Jeff, you're the CEO of the American Board of Physician Specialties. Tell us about your journey to where you are today.
Yeah, prior to law school, I ran campaigns for a living and was in the political world. And during law school, met a couple lobbyists and realized, wow, it kind of gives me the best of both worlds. And I was looking for a governmental affairs job. And fortunately, being in Tampa, I came across a posting for the American Board of Physician Specialties. Over 12 years ago, I started as someone in their government affairs department. I have been with the organization for the last 12 years. I've worked my way up, and now I'm CEO, and I've been CEO for the last 3 years and was executive director the 3 years prior to that.
All right. So you made that transition from the political world to the healthcare world, and you've been with the healthcare world over the last little while. So what's something about healthcare that you've learned that surprised you?
When I first started, I realized that there's more politics in healthcare than there was in politics, which has been shocking to me. And it's kind of part of the reason why I like working at the organization I work at, because it's great helping to be a voice for the little guy, helping to be a voice for physicians that are being discriminated against because of that political machine, which I always thought was in politics, not just in medicine, but there's politics everywhere.
All right. So we're going to talk about Manny's Kevin MD article, Stop the ABPS Monopoly. The ABPS is the American Board of Medical Specialties. So, Manny, you wrote this article back in March of 22. How did this article come together?
Well, Kevin, how it came together was during the most critical time in our country with the COVID crisis. Some of the hardest hit ERs, specifically those in New York City and Detroit, and of course some other big cities, didn't allow board certified emergency medicine doctors to even step foot in those ERs because they're board certified by the ABPS, the American Board of Physician Specialties, and not the ABPS. Kevin, what's even crazier is that these hard hit cities allowed third-year medical students, okay? And we're even calling on retired physicians, who knows how long it's been since they even seen a patient, to help them out instead of ABPS, board certified EM doctors. Okay. So that was really when I heard about this, I'm just an orthopedic surgeon. I'm getting this word from another field of medicine that was like, okay, something needs to be done about this. So that's really what I wrote the article. But I think it would be best for Jeff to explain the entire issue, since Jeff, didn't you testify before New York State Legislature recently about this?
Yeah, I did. This is something, it was shocking when it first happened. And then once after COVID, the New York State Legislature had a combined session to have a hearing on trying to find out what lessons learned from COVID so they don't happen again. And when they saw what was going on in some of these hospital systems, when they were begging for help, when they had, the morgue trucks out there on the street and people were trying to volunteer, but because they weren't ABMS or ABEM docs, then they weren't viewed as good enough. But some of these were leading physicians. Some of these physicians have been practicing for over 15 to 20 years. These physicians have been medical directors in some ERs, but they're being told no, not because how well they can practice, not because of anything of their education. It's just because they chose to be board certified over one organization over the other. And it was disconcerting to me, because it was where I said earlier, the politics of medicine. This wasn't about politics. This wasn't about anything. This is about patient care. This was about really treating those that needed to be treated and putting all your resources out there. And we were seeing this in some of the most affected areas where they were allowing the politics of medicine and allowing the push for a monopoly to overpower patient care.
So Jeff, tell us more details. Like, how did you hear about these cases? Did some of your members come to you and say that we can't practice because we're not ABMS certified? So go into more detail. We'll keep it anonymous, of course. Tell us some specific case studies to give us an idea of what you were hearing.
Yeah, first and foremost, we were hearing from our own diplomat doctors. We get this all the time when people reach out to us when they're applying to jobs, and they'll say, "Look, I'm applying for a job. I got all the way through the credentialing process. They like me. Oh, but then they found out I'm ABPS instead of ABMS, and they're telling me that they only want an ABMS position." So, and then usually it's an educational period, and it's, showing them how you can credential. This is a recognized choice and certification. But during COVID, it was a little different. We had people that were volunteering. This is what's amazing in this world. When bad things happen in bad places, people step up, and physicians and the first responders are the heroes out there as well. And they stood up and they wanted to go into these areas to help these individuals. And they were being denied solely because this was a position that they wanted an ABMS only physician at. And I started looking at the job boards, and we noticed recruiting listings in Detroit that were doing the same thing. And then the recruiter even called us and said, "Well, it's not me, it's my employer," after an article was written by a investigative journalist on it. And we said, "Look, I know it's your listing, but it's your client, but it's still a listing that is openly discriminating against when you are needing physicians in an area." And this was something that was important to us to get out there, because it's wrong. It's not saying anything else other than that it's wrong, and that when you are in times of need, and you, like Dr. Konstantakos said, reaching out to residents to come get a license early. You've got people that have been retired begging them to come back, when you have a actively licensed physician in the state of New York that is well qualified, that is a emergency medicine physician, and is being told no just because of the certification. It was wrong.
So Manny, as an orthopedic surgeon, you have different paths to certification. Tell me the questions that you asked yourself as you were making those decision process, and why did you choose one route over the other?
Well, Kevin, the reason I chose ABPS is because I wanted a choice in board certification. In residency, we're only told about one board. I mean, let me ask you, Kevin, did you hear of any other board in residency other than the ABMS?
Well, residency for me was 20, 25 years ago, but it's tough for me to recall.
But the whole point is, most chances are you didn't. And the reason is because residency programs work hand in hand with the ACGME. So the ACGME is the Accreditation Council for Graduate Medical Education. The ABMS co-founded them, okay? And therefore, the residency programs in all fields, not just surgical like mine, in medicine, all fields, don't allow to have their residents take a board other than the ABMS. They're not even allowed to tell residents about other boards, such as the American Board of Physicians Specialists. And let's face it, I mean, these residents are always pushed, in fact, required, all residents in America, to take the ABMS boards, and therefore a monopoly is created. And let's face it, Kevin, when are monopolies ever good? I guess except for the guys that are in charge of the monopoly, I suppose. But I mean, you got to have competition, okay, especially with different board certifying bodies. Because even take healthcare aside, just for business purposes, for example, in business in America, competition improves innovation and decreases costs, okay? Monopolies do the exact opposite. And monopoly has been created by the American Board of Medical Specialties. So we need to tell our residents about having a choice. And that's the reason why I went with the American Board of Physician Specialties. I wanted a choice in board certification. I'm very glad that I went with the ABPS.
So Manny, so when you were making that choice, when you were a resident or fellow, when you were still in training, so why didn't you go along with the crowd? Why didn't you just say, you know, everyone else is doing it, I'm getting board certified like everyone else using one group? Why did you seek out an alternative choice?
Well, thank you for asking me that, Kevin. So in addition to spending all the hours in surgery and looking, perfecting my technique, I would also be listening to other doctors either complaining about the MOC, which is a direct result of the ABMS monopoly. The MOC is a maintenance of certification. They were being, these great attending physicians, 10, 15 years out of practice, were scared to death because they didn't do the MOC, their risk of losing their certification. I have an older brother who was a cardiothoracic surgeon, and he has to maintain his general surgery boards. Okay, he hasn't practiced general surgery in who knows how long. I won't say he's that old, but anyway, he has to maintain his general surgery boards just to be a cardiothoracic surgeon. Kevin, he hasn't practiced general surgery in decades. So it's this monopoly that's being created. And I said, look, I'm not going to be part of this run-of-the-mill, type of thing where it just leads to misery and ultimately leads to bad patient care, because you'll be so miserable and so, focused on, doing what the crowd is doing, maintaining this certification that you're not even practicing anymore, this field, for example, that I just mentioned. So to me, that it's all about patient care. And we have to ask ourselves in the question, why do we become physicians in the first place? And for me, it was always putting patients first above all else. Patients always come first. And that's what the ABPS focuses on.
Now, Manny, among your orthopedic surgery colleagues, what proportion of them are certified by the American Board of Physician Specialties versus the ABMS pathway in general?
Yeah, Kevin, I don't know the exact numbers for that. Probably Jeff might be able to provide you with those numbers. All I know is that, I'm very, very happy because with the ABPS, it's an all volunteer physician-based organization. We're allowed to have a voice. None of our members are paid at all. In fact, Kevin, I do have some data here showing that exact answer to that question. So in 2016, the president of I think it was the American Board of Pediatrics or the American Board of Internal Medicine, both falling underneath the ABMS boards, reported a revenue, Kevin, of the president in excess of $1 million, in addition to having a Mercedes-Benz and a nice apartment in Chicago. Conversely, let's talk about the member boards of the ABPS, for example, the American Board of Integrative Medicine. Kevin, do you know how much the president of that board of the ABPS made that year?
Nope, go ahead.
$0 and 0 cents. Okay. So you tell me, for a non-for-profit entity, you can figure that out. Who's supposedly a not-for-profit who really is putting patient care first above all else.
For those physicians in training that are considering these different pathways to board certification, tell me, contrast those two pathways, the ABMS, the traditional pathway, versus the American Board of Physician Specialties. If you contrast those routes, just for those who are listening to this and are first hearing about this other pathway.
The pathways are pretty much very similar. At the end of the day, we're a competitive recognized choice. I know some people like to say an alternative choice or an alternate option. For us, it's a competitive option. We do have some competitive boards like orthopedic surgery, like radiology and dermatology and internal medicine, which has been growing ever since, as Dr. Konstantakos talked about, the MOC, as well as when ABIM decided to say if you haven't gotten board certified within 7 years of completing your residency, then you're no longer eligible. For us, internal medicine physicians are still eligible, and they have come to us to get certified. We look at this as recognizing your training, and demonstrating your knowledge. I actually had a physician told me who has been practicing internal medicine, I think like 15 years or more, didn't have the need or the requirement to get certified, and then his hospital was updating, and then they said, well, you have to get certified now. You're a medical director. And he went to get certified, and the ABIM told him, well, maybe he should think about going back and doing a residency again, because that's the only way he could be eligible to take the test. For me, again, talking about patient care and what's the best for that hospital, is that hospital for that person to quit their job, to go back and do a residency, most likely going to have to be an international residency because he or she's been out for this long. So that's where we have the competitive options. What also makes us unique is we have innovative options. And it's one of those things where I always say it's what happens when you have a monopoly and you only have ABMS. ABMS defines what is a specialty and what is not. We, as a competitive option, have developed some boards that they haven't. We have the first disaster medicine certification, which I say should be every physician's true second specialty. We also have what Dr. Konstantakos talked about earlier, the first integrative medicine board certification. That I always say it's nice about this is it really combines the Eastern and Western medicine, is like I used to say, and that this is for those physicians that have completed an academic fellowship in integrative medicine. We only allow recognized fellowships that have been recognized by an academic consortium of integrative medicine, and these fellows are able to then demonstrate their knowledge and competency in integrative medicine, just like you did in internal medicine. Integrative medicine is a new field. It's a new specialty. Most recently, we were able to get a taxonomy code for the National Uniform Claims Committee as a sponsor for integrative medicine, because it is a defining and new developing specialty. We're seeing hospitals develop departments. We're seeing the Department of Veterans Affairs really getting into this because of the opioid crises and things. So by having a choice and by having another organization, you're able to have more than one option for certification, but you're able to have innovative options. If one board didn't view this as a money-making or one section of this, maybe this other board did, because they see the good in this specialty as well. And creating that creates options, and that's all we've ever wanted. We're not trying to replace the ABMS. We're not trying to be the only certifying body. We're trying to be a competitive option so physicians have a choice. And with that choice, it'll make them look at the standards. It'll make them look at the requirements. It'll make them look at the cost. Your internal medicine, look where the MOC started, you want to say almost 4 or 5 years ago, the big anti-MOC movement from the internal medicine doctors. Look what that push started to cause a little change. Can you imagine if you had a Pepsi versus Coca-Cola or a Ford and a Chevy that gave options, true options in internal medicine that were tied to ACGME residencies, that were tied to large hospital systems that the ABMS wasn't able to just push their monopoly into and be the only option?
So for internal medicine recertification, I certainly know what I have to do from a maintenance of certification standpoint. So from an ABPS standpoint in internal medicine, what are the recertification pathway options?
Right now, we still have a recertification exam. We understand that the idea of longitudinal assessments and continued certification is the future. We're looking at those options. But for us, as a physician-led and physician-run volunteer organization, we want to ensure that whatever we do is right for the physician. I always say the MOC was pushed out too quickly, especially in internal medicine, and the fallout they received. So we have a specialty-specific CME requirement that you have to do so many CMEs, someone self-assessment per year, that you need to, at the end of your 8-year period, you give your CMEs. You need to take 8 hours worth of ethical training, because to me, that's also very important. We're the only certification that requires that. I've been to enough medical board hearings as the lobbyist and the external affairs guy for the organization to realize physicians aren't getting in trouble because they're bad doctors. They're getting in trouble because they're bad unethical doctors. And having an 8-hour ethics training for us was important. And then we have a 100 to 150 question recertification exam that tests your clinical knowledge in maintaining. So that's the demonstration component. We are looking at options for continuing certification, but it's going to be more of a not just CME. There has to be some demonstration component to it. So there may be some self-assessment tied to the CME, some form of this, but it's not going to be an overly burdensome, very cost-heavy module-based system that, your internal medicine, you've seen the hand washing module.
Sure.
So that's for us. We want to make sure we get it right. And until we have it right, then we're going to continue on the processes that we have, because it is a valid, recognized system. The exams are psychometrically sound, and it meets, all the standards for certification and testing.
All right. Take-home messages. Manny, why don't we start with you?
Yeah. So Kevin, as we know, one of the most fundamental concepts of life, especially here in America, is freedom of choice. Okay. And physicians have a choice for board certification. Residents have a choice for board certification. And residency programs need to inform the residents of these choices, specifically for the ABPS, so the residents can really decide for themselves. Okay, so residency programs really need to inform the residents of the ABPS.
And Jeff, we'll end off with you. What are some of your take-home messages to the Kevin MD audience?
Just to echo what Dr. Konstantakos talked about, is that there is a recognized choice. There's a competitive option. Physicians need to know that. Hospitals need to get updated with what the current standard of board certification is. I always say, just because ABMS is the largest one doesn't mean they're the only one, or just because they're the most popular brand doesn't mean that's what defines board certification. Make sure your bylaws are current if you're a hospital, and if you're a physician, understand you have a competitive choice. And even if you're currently certified by ABMS, but you're angry with the situation, you don't feel like being a number, we will actually recertify ABMS physicians in the specialties we currently certify in, and they have to go through the recertification process so they can have a choice. They can have a say in their certification. They can participate in an organization and be part and not just a number.
Manny and Jeff, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you.
Thank you.